The executive functions, we all have them, and there are some other conditions. If somebody's depressed, their executive functions go down. If somebody's anxious, they go down. My goodness, if you have the flu, your executive functions will go down. But the thing with ADHD, it's a chronic developmental delay in the development of these skills. So there's a chronic lag. It's almost like starting a race, 30 meters behind, and chronically trying to catch up. So what are the executive functions? And I've found this to be a very useful model to help see ADHD in children, adolescents, adults, and then to see the effects rather than worrying about hyperactivity, impulsivity, or inattention. I like the definitions put forward by Russell Barkley. The behaviors that we do to ourselves to self-regulate, or in a more recent expanded definition, the executive functions represent self-regulation across time. The ability to set out and implement a plan over time towards a goal you want. You're invested in this. And maybe it involves working with other people, collaboration. It could use social institutions like work or school. So you want the outcome, but the payoff, the goal, is not immediate enough. So it's a delayed outcome. It's like investing for retirement. It's like exercise. So using that definition with a gentleman whom I had completed an adult ADHD evaluation with, and I used that description, he slapped his knee and he said, "That's it. My boss always tells me if he needs it from me in 10 minutes, I give it in 5. If I have 2 weeks, it takes me a month." Why? It's important. The intellectual part of his brain says, this is important. I want to start working early. This will be good for my career. But the reward networks of the brain go, yeah, but I don't want to do it now. I have plenty of time. I'll do it tomorrow. Oh, it's the weekend. I have plenty of time over the weekend. I didn't get to it over the weekend. I'll start on Monday. Putting it off an hour a day at a time. And what happens next? It's due tomorrow, even though you had plenty of time before. That, in a nutshell, is the executive functions and the difficulties faced by individuals with ADHD. And this is a very scientifically grounded model. The executive functions emerge developmentally. Briefly, the first one is inhibition. The ability to stop and pause. And in that pause, now we can act with intention, make decisions. I heard a nice quote. When you press a pause button on a machine, it stops. When humans pause, we start. So with that space, rather than reacting, pausing, nonverbal working memory, that's the ability to imagine in our mind. It's like the video replay in our mind. So we can figure out what happened, what led up to this point, and then put the movie forward to figure out, if I do this, what will happen? If I do this, what will happen? And if I do this, what will happen? So we can act with intention. Verbal working memory, that is talking to ourselves inside our head. The language that we use to speak internalizes and becomes our thinking processes. So let me ask, how many people here, show of hands, talk to yourself inside your head? Those of you who didn't raise your hand, do you know what you're saying? I don't talk to myself inside my head. Even if you say you don't do it, you're doing it. So those are cognitions and how these can help motivate us and push us towards our endeavors. Emotions. You don't see emotions anywhere in the official diagnostic criteria. But we now know there's firm evidence that emotional discontrol is a core feature of ADHD. And motivation. What is motivation in executive functioning terms? It's the ability to generate an emotion about a task in the absence of immediate consequence. The ability for the student to make him or herself feel enough like studying 3 days before the exam rather than the night before, when there's motivation everywhere. It's called panic, which is a huge motivator. Then reconstitution, that comes from play. Taking things apart, putting them together, role-playing, playing different jobs, playing superhero, trying different things. This is that innovative thinking that was mentioned in the video showed earlier. Being able to solve problems, come up with new solutions. Tom Brown has some very similar ones. So again, activation, focus, effort, memory, action. These help us see ADHD in children, teens, and adults, rather than this attention, hyperactivity, and impulsivity. Another way to think about it, and I like this quote, the executive functions are considered to be housed in the prefrontal cortex, the frontal part of the brain. So the frontal cortex, where the executive functions are, make you do the harder thing when it's the right thing to do. The thing that you may not want to, it's an investment. It's getting to the gym, even though you don't feel like doing it. It's inhibiting eating the extra morsel of food when you would really like to eat it. It's studying. I was a decent student. In my life, I was never in the mood to study. But we have to find a way to complete it. In a very recent study, the executive functions, I'll go back. The executive functions and inattention actually combine as one factor, and that is the best way to identify ADHD. So the executive functions, and they are underrepresented in the official diagnostic criteria. And emotional discontrol, it's a core feature, again, not listed anywhere in the official diagnostic criteria. So that's just the background of when we're talking about ADHD, how can we see it? So yes, somebody can be very focused in a very enjoyable activity or a passionate activity, but then something else that the person may be invested in, at least in the outcome, school, a longer range plan, those are harder because the goal might be too far away. It's almost invisible. So cognitive behavioral therapy, that's what has been found to be very helpful for adults with ADHD, and we'll be drawing on a lot of principles here. Developed by Dr. Aaron Beck at the Center for Cognitive Therapy at the University of Pennsylvania as a treatment for depression. And it's a wonderful quote by Dr. Beck. But in an all too basic nutshell, a situation occurs, we have a thought, a cognition, hence the cognitive in the cognitive behavioral therapy. So how that thought, or how that situation, I should say, is interpreted affects our emotional reaction and then what we do. Probably that's a little too linear, so thoughts and feelings and behaviors affect each other. Sometimes the emotion will come first, or we can change behaviors and do things differently, which may change our thinking. But the cognition is a useful way into this cycle. What thoughts went through your mind when? Now, one of the things about ADHD is it is not the result of negative thinking. I'll say it again, it does not result from negative thinking. As was indicated in the video, it's highly genetic, not 100%. Genes interact with environment. There's biological networks that go into support the executive functions. So that's why ADHD can look very different. There's a lot of wiring and different interacting networks that may affect one another differently in different people. But we've still found this model adapted for ADHD to be helpful. So how has cognitive behavioral therapy, a non-medical treatment, a form of psychotherapy, how have we modified it for use with ADHD? So some of the assumptions or premises that individuals with ADHD will experience some symptoms falling on a continuum of severity. Tom Brown will say ADHD comes in small, medium, and large. And there can also be, because it's a continuum, not a category, there can be some people who have ADHD light or subthreshold features, maybe not the whole gamut of symptoms. And they emerge in childhood or adolescence, even if it's not recognized as such then. ADHD makes a direct and causal contribution to functional life difficulties, again, from interference to impairment, and variation in different domains and settings and situations. So an athlete with ADHD might be very focused, and the structured workout routine, they're very good at following that, but has difficulty in school or in their personal life. And it is complicated by emotional or learning issues. More importantly, or as importantly, I should say, these symptoms then affect the experience of the individual with ADHD and their performance in various situations. Again, assuming that the person has some investment in them. They want to be a good athlete. They want to be a good friend. Even though school may be boring, they want to do well. They want to at least get through it. And these things feed back on sense of self, identity, and efficacy, the belief in one's ability to get things done. So just like the video was showing about the messages from a teacher and from others, these things get woven in to the person's sense of self. So there's that ongoing interaction with the environment, what you're putting out, what you're getting back, and ADHD can punctuate those experiences, and that affects how you see the world, how you see yourself, and how you see your future. Those cognitions, those thoughts we talk about. And there can also be, positive relationships that support us or support our strengths, so it's not all or nothing. But it all goes in, so it's not just the symptoms or about school, it's about the individual and how he or she views themselves and their options. So what are the premises then from this adaptation for what we do to help people? Well, one, that ADHD is a quantitative difference, not a qualitative difference. And this leads to the mistaken assumption that, well, doesn't everybody have ADHD? I forget my car keys, I procrastinate on things. When you actually do a thorough evaluation, it's not even close. No, not everybody has ADHD. But it's a quantitative difference. It'll seem familiar to other people, but it differs in the frequency of problems and the magnitude of the problems. And it's not a knowledge problem. It's a performance problem. It's an implementation problem. That gentleman that I mentioned at work, who I did the evaluation on, who said, when my boss needs it in 10 minutes, I can deliver it in 5, he knows how to set up a plan. He knows what he needs to do. You could go to any student and ask them, what are you supposed to do if the teacher asks a question in class? 100% correct response. Students, even with the worst ADHD, will say, raise your hand, wait to be called on. But when the teacher in the class asks the question, what will happen? Answer, then the arm goes up. It's the ready, fire, aim response. And these implementation problems are from that impaired self-regulation. Again, difficulties organizing behaviors across time, but they also create procrastination problems, poor motivation for behavior, and motivation is one of those words that makes it sound like you really don't care, or if you were motivated, or if you had willpower. No, again, going back to motivation, motivation's the ability to generate an emotion about a task in the absence of an immediate consequence. So there may be a strong desire to get homework done, to do something else, but that might be counteracted by a greater desire to do something else, or over time, particularly with school, there's a lot of negative emotion associated with a lot of these things that you're being told this is good for you. You should really study this now, university, whatever's coming on later on. So at the same time there's a desire to get started, there's many more things weighing down. And we have a great solution for that. It's called avoid, the most addictive drug known to man, because it works great for 10 seconds. And then you escape, you get relief, but then it's waiting for you later on. And we know it logically, but that's where ADHD undermines the logic. Poor task endurance, all the things we're familiar with students, loved ones. And that last one, it punctuates experience. It interrupts it. It extends the negative experiences, or at least it extends time on homework or other things, which can get in the way of other endeavors. And difficulties exercising, executing otherwise known coping strategies and skills. We know it logically, it's a performance problem. And these can be magnified by coexisting emotional issues, learning issues, leading to increased disengagement, pulling away from things, social, school, otherwise. And these can affect different levels of experience, how we think about things, how we justify to ourselves, to others. Behavioral, our investment, viewing behaviors and actions as an investment. And what happens over time, ADHD makes it seem like some endeavors are a bad investment. I'm going to study for twice as long for the test as any of my peers, and I'm still not sure if I'm going to pass. Why would I want to do that? One part saying, you know you should, and we're getting that from elsewhere, but internally, it's difficult, it's painful. I remember one patient described to me, he said, paying attention in class was so difficult, I felt I was almost about to pull a muscle. I was working so hard, straining so hard to try to stay focused, and I couldn't. The emotional reactions, and emotions go into how we value tasks. The implementation, the ability to get engaged and do things, and then also the effect on relationships. And this is a pretty profound one. It could be peer relationships in school, co-parenting or romantic relationships in adulthood, friends, co-workers, the like. And then in this case, being a therapist, I'm usually talking to therapists, but this could be an educator, a partner. The connection with others is a vital source of support, empathy, and understanding. There still may be responsibilities for follow-through, but that sense of somebody understands, somebody gets it. And it's not just all about, I guess you don't have the willpower, or if you only cared a little more. My experience working a lot with adults, in some ways they're harder workers than anybody else I've ever encountered. These are the people who stay at work until 8 p.m. trying to catch up with their work, and they go, I really didn't get started. Everybody thinks I'm so devoted, but I really wasn't able to focus until noon, and then I had to stay later just to do all the work I should have done earlier, or doing more work on the weekends or whatnot. So in terms of cognitive behavioral therapy, we're not going through like therapy 101, but to start talking about the skills that might be useful in school, at home, and elsewhere. Just for purposes of illustration, we divide them into 4. The cognitive modification, how do we change our thinking? Behavior modification and coping skills, how do we change what we do? Use the skills that will be helpful for managing ADHD, which would seem like it's a recipe for disaster. If ADHD is difficulty organizing and implementing behaviors across time, what does a psychotherapy, a psychosocial treatment require you to do? You have to do things to change your behavior. But I think we and others have found some things. Dealing with the emotional side, acceptance, mindfulness, and persistence. Not mindfulness exercises, that's going to be covered very well later, but sort of a mindful framework, and I'll talk about that in a little bit. And then there is a set of what are called implementation strategies. How do we go from not doing to doing? So looking at some of the lessons learned, and this is just a brief snapshot, in terms of behavioral, making whatever the task is manual. One of the things we found is that a lot of time individuals will procrastinate, not necessarily on something enjoyable, like changing their Facebook profile picture or something like that, but they might do another task.